A radical change in approach towards digital technologies is needed to avoid wide discrepancies in healthcare around the world. That's the conclusion from a commission of experts reporting for the medical journal The Lancet. Well, let's talk to one of the authors, Dr. Anurag Agrawal, Director of the Institute of Genomics and Integrative Biology in Delhi. Thanks very much for joining us on the programme. Why do you make this call for a radical change in approach? What's going wrong when it comes to digital technologies and healthcare?
I think what we fail to recognize is that digital transformation is no longer just a way to deliver health. It's a determinant of health. Access to these technologies, ability to use them, will soon become the way in which people can access the entire systems and become a determinant, particularly for young children who are still growing up. And our commission calls attention to this very important fact and asks all governments to consider these as determinants of health that must be planned for as we transform healthcare.
What has the pandemic shown?
Well, the pandemic has shown the importance of digital tech in providing healthcare and services at scale, at unprecedented manner, the use of artificial intelligence, the use of a variety of technologies that made our response possible, but has also shown very clearly that inequity will grow in such a setting, as we're already starting to see. So I think the pandemic helps us understand the potential of the health tech system, but also warns us that in the time to come, we must use it much, much better.
And your report highlights young people in particular. What is their experience around the world?
It's very surprising that, when you talk to young people, and which I'm surprised that people don't do more often, what they expect out of health is so different from what older people expect. Older people typically are focused on disease, and young people are typically focused on wellness, disease still being many years away. They're also focused on experience, equity, mental health, and they're very, very focused about being enabled to participate, to take decisions, and in particular regarding job opportunities. So many different considerations from their point of view in what they want to learn in the digital world.
If there's one conclusion about what really needs to be done to change things, to improve digital access in terms of healthcare for people, what would it be?
I would say, imagine the health system through its primary determinants in the digital world, focus on building those foundations, and build a stable enterprise on top of that.